Hello, and welcome to the Asthma and Allergy Foundation of America's latest education program titled Understanding Nasal Polyps, Part 1, Nasal Polyps Basics. Today's program is developed independently by AAFA and made possible by support from Sanofi and Regeneron. This video is the first in a series called Patient-Centered Education and Care for Nasal Polyps, or PCE-NP for short. The overall goal of PCE-NP is to support people with nasal polyps and improve the patient-clinical partnership in managing and treating nasal polyps. My name is Jay Norris. I'm the Mission Program Administrator for the Asthma and Allergy Foundation, and I'll be your host for today. I'm also excited to introduce you to our two speakers today, Dr. Stella Lee and Dr. Tanya Laidlaw. Thank you both for being with us today.
Thank you.
Dr. Stella Lee is a leading rhinology expert who serves as the Chief of Rhinology at Brigham and Women's Hospital and an Associate Professor of Harvard Medical School. Dr. Tanya Laidlaw is an Associate Professor of Medicine at Harvard Medical School in Boston, Massachusetts, in the Division of Allergy and Clinical Immunology at Brigham and Women's Hospital. Please take a moment before we start to review our disclosures. So what will we discuss today? Well, we'll cover the following subjects. What are nasal polyps? Symptoms and diagnosis. Conditions that commonly occur with nasal polyps. Types of doctors who treat nasal polyps. Overview of treatment options and overview of surgery. And later in the series, we'll also take deeper dives on advanced treatments, surgery, and practical management of living with nasal polyps. At this point, Dr. Lee, I'd like to pass it over to you to give us an overview of symptoms and diagnosis.
Great. Thanks, Jay. I'm excited to be here and excited to be here with Dr. Laidlaw, who we work closely with at the AERD Center, the Asthma Exacerbated Respiratory Disease Center here at Brigham and Women's Hospital. So what are nasal polyps? Polyps are soft, painless growths that are inside of the lining of the sinuses. They can grow out and also obstruct the nasal cavity. So oftentimes they're first diagnosed when people go to the doctor and you see actually the polyps growing inside the nose. However, they do originate from inside the sinuses often, and they're caused by chronic inflammation that is on both sides of the nose, or bilateral. The vast majority of polyps are not cancer. And that's what we say, that they're benign growths. And unfortunately, because they can block the nose, it can make it harder to breathe and also hard to smell and appreciate different flavors in food and things that we drink, like our coffee in the morning. So it's really a impactful disease on multiple areas of quality of life. So this condition is also called chronic rhinosinusitis with nasal polyps, or CRS with nasal polyps, or nasal polyp syndrome. And the main takeaway is that this is inflammation that occurs within the sinuses and the nose. Who gets nasal polyps? It is a common condition. It happens worldwide, but we also see it quite commonly here in the US. About 1% to 2% of adults in the US have nasal polyps. It's very rare to see nasal polyps in children. In that situation, we think about diseases such as cystic fibrosis, and that's a different condition that we won't discuss in this workshop. Nasal polyps we can have a higher risk in patients who have asthma, for example. So a lot of people who have nasal polyps also have comorbid, or we think of at the same time, asthma, but also allergic rhinitis. Patients can often have chronic sinus infections and exposures potentially to air pollutants or different allergens that can contribute to chronic inflammatory problems. Some patients may also have a family history of nasal polyps, and that's still being investigated. And cystic fibrosis, as I mentioned, is a condition that we do see nasal polyps, but that is a different topic, and we'll for a different workshop. Let's talk about some of the common symptoms that we see in patients who have nasal polyps and chronic rhinosinusitis. A lot of the time, it can be very difficult to breathe through the nose. So we see blockage of the nose. There can be a lot of congestion of the nose, so swelling, as well as reduced sense of smell. So those are actually the top two symptoms that people who have CRS with nasal polyps experience. And as a result, it can be very hard to experience the flavors in food. And not only that, it can be problematic if there's a fire or smoke in the house or things like that, or spoiled food. So those are really kind of serious issues too we think about and counsel patients on. Other symptoms include significant mucus with postnasal drainage, a runny nose, and that can be throughout the day, and it's very disruptive to people's quality of life. Some patients can also have facial pain, pressure, and sinus infections that keep recurring over and over again. And because of that, a lot of people who have chronic rhinosinusitis with nasal polyps have sleep disturbance, difficulty with snoring, and in general breathing. So the most important thing to remember here is that a lot of these symptoms, unfortunately, do mimic a lot of other symptoms related to allergies or allergic rhinitis and other respiratory problems. So that can lead to a significant delay in care and diagnosis and the management of patients who have chronic rhinosinusitis with nasal polyps.
So what are some conditions that we might see in our patients with polyps that they have in addition to that? So somewhere around half of our nasal polyp patients also have asthma. As Dr. Lee mentioned, we call it comorbid asthma happening at the same time. And actually, relatively commonly, that asthma, when it happens in our adult patients with nasal polyps, is actually what we refer to as adult onset asthma, meaning that they didn't have asthma as a little kid. It's something that just sort of happened as an adult, so that the nasal polyps started in adulthood and their asthma also started in adulthood. Many of our patients, probably a little more than 50% of our patients with polyps, also have allergic rhinitis or allergies that cause runny nose as well. A sub portion, like a small percentage of patients with nasal polyps, have something that we refer to as AFRS, or allergic fungal rhinosinusitis. And in some senses, that just is a type of nasal polyp that you develop. It's much more common in parts of the world or the environment where it's a relatively warm, humid area, where mold in the area, fungus in the area is just more common, less common up in the Northeast, but still seen even in colder areas. And then something called AERD, aspirin-exacerbated respiratory disease, or NSAID-exacerbated respiratory disease, when patients have polyps and asthma, and also get reactions to things like aspirin and ibuprofen and naproxen. And then the last two listed there, eosinophilic esophagitis, EOE for short, or reflux disease, GERD for short. These are actually disorders within the gastrointestinal tract, and they aren't directly related to polyps, but there is a slightly increased chance of having one of these if you also have polyps. So it's something we'll often ask our patients about specifically to see if they might have symptoms there as well. So how do we go about diagnosing the patient in front of us to confirm or to understand if they really have nasal polyps? I mean, honestly, what Dr. Lee and I do is have a long conversation with the patients about the medical history. We just ask a ton of questions. When did it start? What symptoms do you have? What makes it worse? What makes it better? What brings it on? What have you noticed? And out of all of these, what things bother you the most? Every now and then we'll bring up symptoms the patient didn't even realize they had until we start pushing a bit about it. So we're reviewing all of those symptoms, and that's to kind of get the story of the medical history. And we'll often also use things, they're more standardized questionnaires that might ask about symptoms, but often have a scale, like 0 to 5 being the worst, just to make sure that we're really following sort of each possible symptom that you can have, and then we're not forgetting anything. And then we can track that over time to see how that scale changes with treatments and over the years. And then the really objective measurements, like how do we confirm that's really those symptoms are for nasal polyps? So the first is nasal endoscopy or nasal rhinoscopy. And this is done with a little scope and a camera where it actually looks into your nose and into your sinuses to see if they can physically see polyps there. That's something that Dr. Lee does in her clinic very commonly. I would say close to 100% of patients who are going to be diagnosed with polyps should have a nasal endoscopy at least one time in their life. And then things like imaging, and the most common thing that's done is a CAT scan, CT scan. And again, not 100%, but pretty close to 100% of patients who are being diagnosed with polyps for the first time it might be a good idea to get this kind of CAT scan imaging, because that way they can look also further inside the anatomy of the sinuses to really understand what's going on there. So then what other testing might we do as we're going through the diagnosis of polyps to figure it out? So every now and then, there are actually allergy tests that are specific that we want to understand for sure. Now, patients can have allergies but not have polyps. You can have nasal polyps and not have allergies. And you could have polyps and have allergies, but the two things are different. So for example, you might have nasal polyps and you also sneeze when you're around cats. But even if you're not around cats, you continue to have the polyps. So you might have both things and they make each other worse, but they aren't necessarily causing each other. And that's where those conversations about the symptoms come back and forth as being really important as we kind of work through what the answers to these tests mean. There are also some blood tests that we use sometimes, looking at certain kinds of cells in your blood or certain antibodies in your blood. And every now and then, depending on that medical history, there might be other immune problems we want to just talk about to make sure that we know if you have or don't have. There are also sometimes specific tests used to measure sense of smell, where we actually ask you to understand whether or not you can smell the thing that's in front of you and mark down whether or not you can accurately figure out what that smells like, what that scent is or not. And the blood tests that we mentioned about looking at certain immune cells in the body to understand those levels of inflammation that Dr. Lee had mentioned. So as you've mentioned, we have, as you've seen, we have Dr. Lee and we have me here. We're two completely different doctors with very different training. Many, if not really, I think most of our patients do and should see different types of doctors to make sure that all sides of their sort of inflammatory system in the polyps are appropriately treated. So often we get the referrals from the patient's primary care physician, that's often the first point of contact, where like you've gone to the doctor, you've complained about this enough times that the primary care physician says, I think you need to see an additional specialist to help you work through this. And then, in my job as an allergist and an immunologist, it is my job to really try to manage the inflammation in that immune system, to work through allergies if there are any, to diagnose and to treat asthma if there is any, and all those things can be associated with polyps. And then otolaryngologists and specially trained rhinologists are surgically trained specialists, and they help to establish diagnosis and then also manage the inflammation, both with medical treatments, but also specifically with surgical treatments, which is something that I cannot do in my training. And then every now and then, you either have severe enough asthma that you need to see a pulmonologist that specializes in asthma, or your particular allergy specialist isn't comfortable managing your asthma, in which case having a pulmonologist could be involved if there's coexisting severe asthma or another respiratory disease that we're worried about. So really, the truth is that we often talk about what's called multidisciplinary care, but really it means that you have to have different specialists all working together to treat all parts of your symptoms and your disease to make sure that we're understanding, diagnosing, and treating you in the best way possible, that we can work together for you. So we'll move forward now into some of the approaches that we use for treating patients who have nasal polyps that have already been diagnosed. So in terms of medical treatments, and we're referring to these as first-line medical treatments, essentially, we have a patient in front of us. It's the first time they've ever been diagnosed with nasal polyps. They have no treatments they've ever tried. What are we going to work through for them? We often will use something we call nasal saline irrigations or sinus rinses or nasal rinses. So this isn't necessarily a medicine per se. There's no prescription medicine that has to go into it. But it's a fluid that goes into the nose and in through the sinuses and can help to wash away all those allergens, any inflammation, and it can help to get rid of some of the mucus in the runny noses. We tend to do relatively large volumes, so like 4 to 8 ounces, right? So a half cup to a full cup, not in high pressure, right? Sort of washes in and washes out. Tends to work a little better than just the sort of mild saline sprays, because this really helps to wash it through. It's very important that if patients are using this, they're doing it with clean water. This is going through your entire nose and sinus cavity. And so we want our patients to use distilled water, sterile water. And although it's technically safe to use plain water that's distilled or sterile, it's very uncomfortable to put that into your sinuses or your nose. So we have you use an additional little packet of powder that has a little bit of salt and a little of baking soda, so that ends up being much more comfortable and more soothing for the nasal passage. So that's why we don't use tap water, because it's not safe. It might have infection within it. And also it's really uncomfortable. If you can't get access to purchased distilled or sterile water, you can boil for at least 3 to 5 minutes to make sure that it's completely sterilized afterwards, and then cool it down and use it at the lukewarm temperature for these rinses. So kind of the next layer of this that we'd still count as first-line medical treatments are going to be intranasal corticosteroids. So into your nose and into your sinuses, and we often just call them steroids for short. And this is usually a first-line therapy. Nearly all of our patients will be on these at some point in their life, often in combination with that nasal saline irrigation we just talked about. There's actually a number of studies that have looked at how effective they are, and they can be helpful in improving the symptoms and in reducing the kind of burden and the inflammation within the nasal polyps. However, how effective they are is limited to where they get to, right? So if your polyps are so large, or you haven't ever had surgery to open things up, the sprays may actually only get to the bottom part of your polyps and not really get up into the sinus. Sinus is where our patients are having the most trouble. And there are a number of different ways to deliver or ways to administer these nasal corticosteroids. And this is something to speak with your specialist about. So sprays we're often familiar with over the counter. There are ways that we can do irrigations, and then there are prescriptions that can provide drops or the special exhale delivery systems that kind of can get it a little bit further up. So the only sort of warning that we'll give is that although we often have patients do it in combination with nasal irrigation, you want to make sure you're careful with the timing. So if you're going to do nasal irrigation and you're going to do intranasal corticosteroids at the same time of day, you want to do the nasal irrigation first and then the nasal steroids. If you do the nasal steroids first and then the wash, you end up washing out the steroids right after you do it. So the timing there can be key. So again, intranasal corticosteroids are a type of what we call topical or sort of touching corticosteroid. They're safe, they're effective, and we use them long-term in nearly all of our patients. So if those aren't enough, then often the next step that we try is a short course of what we call oral steroids, so by mouth. These are usually pills. That can be the next step. Prednisone is the generic version of them. That's probably the most common one that we use in the United States. They only act for a short period of time, right? So although they often can make patients feel a lot better, and we'll give, often a few days, maybe at most a couple of weeks of pills for this, within a couple of days of stopping the therapy, the symptoms tend to come back, unfortunately. The problem also is that these medications, either used in high doses or for long periods of time, they have what's called systemic, so all over the body, side effects. So rather than just going right into your nose, they could cause side effects all over, which is why we try to avoid them as much as possible unless we really need them. And there are times that we need them, especially if patients who have polyps and also asthma are having difficulty breathing due to asthma. For safety, we will often use some oral steroids there to make sure that the asthma is calmed down. So although we do use them and there's sort of a trick in our bag when we need them, this kind of steroid exposure can have significant sort of short-term and also long-term bad effects. And so we try to avoid them in the long term as much as possible. So I'll turn it over to Dr. Lee and her area of expertise to talk about sinus surgery.
Great. Thanks to Dr. Laidlaw for that excellent summary. Oftentimes when polyps are quite large and the sinuses are completely blocked with polyps, and we've tried all of these medications that Dr. Laidlaw mentioned, functional endoscopic sinus surgery can be quite effective. And it is indicated and considered when the symptoms are still there. You're still having trouble breathing through your nose, the polyps are still blocking your nose and your sinuses, and difficulty with sleep, quality of life. We really want to make sure that the medications hopefully are working. But if they don't, oftentimes we then go to the discussion about considering functional endoscopic sinus surgery. So what is functional endoscopic sinus surgery? We use a small little scope and a camera that allows us to actually see the polyps and see the actually outflow tracts or where the sinuses drain. And using very meticulous technique, we carefully open the blockages in the sinuses. And this, hopefully, the goal of the surgery is to not only remove the polyps, but reestablish those blocked outflow tracts, we call them, where the sinuses naturally ventilate. And not only that, because we don't have a cure for this condition, this is a chronic condition, just like asthma, the surgery, the goal is to allow for better access for topical medications, as Dr. Laidlaw mentioned, including the irrigations, including the topical steroids, because it's almost impossible for a lot of these medications to reach the tissue that needs to be treated if they're completely obstructed with polyps. And so oftentimes we do proceed to functional endoscopic sinus surgery, especially when the medications are not working. typically the topical steroids, and we really try to avoid the oral steroids if we can, but they can be used for short courses, and saline irrigations. And the other thing is some patients not only have polyps, but they can also have other structural issues such as a deviated septum or other causes of nasal blockage that can be addressed at the same time. The surgery is only one part of the solution to the care management. It's really important what happens afterwards. So once the surgery is done and the polyps are removed and the sinuses are open, it's really important to continue the post-operative treatment, which means using the nasal irrigations and using the topical nasal steroids, because oftentimes patients feel great after surgery, but unfortunately, polyps do often come back without continued maintenance with a topical intranasal corticosteroid. So it's really important to continue those treatments after the procedure and have that regular continuity of care with a specialist like Dr. Laidlaw and a rhinologist or an otolaryngologist like me, and address that underlying inflammatory problem. And there can be exacerbations in times when, all of us will get sick at some point with a cold or something like that, or have allergic rhinitis flares. So all those situations, it's important to have that close follow-up and treat the exacerbations as they come. Recurrence can be a problem, especially in some patients who have significant comorbidities like asthma, such as AERD. And these patients, if you have asthma and AERD and have an AERD encompasses actually the presence of polyps as well as NSAID hypersensitivity and asthma. But if you have those comorbidities, which are the diseases that come along with just sinus, chronic rhinosinusitis with nasal polyps, recurrence can be more common in those patients. So what does it mean, refractory versus recurring? Basically, refractory means that the polyps never really got under great control. They don't respond. We've done all the wonderful things that we try to treat our patients with, including the irrigations, the topical steroids, even a course of oral steroids and surgery. And despite that, the polyps are still present and causing a lot of symptoms such as smell loss, blockage, all the things that we mentioned. Recurring means that they, for a period of time, you did quite well, but however, the polyps unfortunately came back. And this was despite, medications and or surgery. So these are problems that we deal with. This is something that I think that all of us as doctors, we really try to counsel our patients that this is an ongoing chronic condition that we'll have to work together to treat. The good news is that there are other new therapies that are available now for refractory and recurring CRS with nasal polyps, and Dr. Laidlaw is going to talk more about that.
So these new medications Dr. Lee mentioned are sort of broadly referred to right now as the biologics or biological medications. And they are a newer set of medications, especially newer to the asthma and rhinosinusitis field. And they're created to target a very specific molecule or molecules or receptors that are known, that have been found with research to be receptors or molecules that drive inflammation in asthma or nasal polyps. So these are all medications that have been FDA approved that we would use to treat nasal polyps, that can help to improve patient symptoms, can help to decrease what we call the nasal polyp burden, sort of shrink back some of those polyps, and can decrease the inflammation that causes them as well. At the moment, all of the biologic medications we have that are FDA approved to treat nasal polyps have also been shown to be FDA to help treat asthma and are also FDA approved to treat asthma. So for patients that have both of those conditions, asthma and nasal polyps, often a biologic can actually help with both of them. At the moment, all of these biologics are given as injections or as shots, usually in the arm or in the leg or in the belly. And depending on the exact medication, at the moment we have ones that are available every 2 weeks, or some are given every 4 weeks, and there are others under investigation that might be even given less often, depending on the medication itself. And again, depending on the exact medication and on the patient, some of these medications are given in the doctor's office, so you are going in every 2 to 4 weeks, and others actually are safe and can be given at home if you're comfortable doing that, and you give them every 2 to 4 weeks to yourself at home. Although these are great and can really help with those refractory or recurrent polyps, at the moment, again, these are all currently considered to be long-term treatments. In other words, they work well as long as you're on them, and you can stay on them for as long as you need to. But at the moment, none of these appear to yet be a cure. In other words, if we stop the medication, the symptoms will slowly start to come back, and the polyps will slowly start to come back. That's an area that we're working on to make better in the future. So as you're looking forward as a patient to your next visit with any of your specialists, right, your pulmonologist, your otolaryngologist, your rhinologist, your allergist, to discuss your polyps, what kinds of things might be important for you to kind of plan for the next visit? I do think it's important that you have sort of a current symptom diary, kind of keeping track of it in general, to share with your doctor. So especially letting them know, what are the things that really bother you the most, right? There are patients where it's the sound of their voice being sort of stuffed up that bothers them, because they speak on the telephone a lot at work and it's very embarrassing. There are others where to them, like smelling and cooking and being able to smell and taste their own foods is by far the most important thing that they miss. And it might be important for your physician to know which of those two things bothers you the most to help target what you care about the most. It also might be helpful, if this is a doctor you've seen in the past, to let them know what's changed. Have there things where the treatments worked brilliantly and things got dramatically better, or something that wasn't bothering you at their last visit now has become a problem? Those changes can be very important. And those changes and and starting off with what bothers you the most is a very helpful conversation to have as you and your physicians together decide what treatment might be the most important or the most valuable to you, so that your goals and your concerns are the things that are really foremost in the physician's mind as they talk through you and answer your questions, your concerns about what treatment might be the next best step for you.
Well, Dr. Laidlaw, Dr. Lee, thank you both for joining us for the workshop. Before we end, though, I would like to start with some commonly asked questions.
Sure.
The first one will be for yourself, Dr. Laidlaw. Could you please answer for us what caused my nasal polyps? That's a commonly asked question.
So I'm ashamed to admit that the answer almost always is, we don't really know. There isn't a clear single answer I can give you. And we've done a lot of research in the area over the last couple of decades, and we still don't have an answer. So folks of all walks of life from all over the world, of all ages, can get nasal polyps. There isn't a single job or exposure or toxin or allergen that we know is the cause of everyone's polyp. We know there's inflammation, that overall, that general sense of inflammation in the body and in the respiratory tract, or the lungs and the nose, is what leads to the polyps or what drives the polyps, but the exact cause is not yet known, and that's very frustrating, both for us as physicians and I suspect for our patients as well.
And could you also answer the commonly asked question, will my kids get nasal polyps?
Good. So we can never guarantee one way or the other, but very, very rarely are nasal polyps truly hereditary. So every now and then there is a family history of folks where, aunts, uncles, parents, grandparents might have had nasal polyps, but the vast majority of our patients with nasal polyps have no family history of nasal polyps. And in general, we tell our patients that your children have no more or less chance of getting nasal polyps as you did.
Dr. Lee, are nasal polyps precancerous?
The good news is that chronic rhinosinusitis and the nasal polyps we're talking about are not cancerous. They're completely benign. It's inflammation. So they are not cancerous. One thing that we are cautious about, and why Dr. Laidlaw also mentioned why a nasal exam, nasal endoscopy is really important, and also sometimes a sinus CT scan, is because sometimes if there are polyps that are in one sinus or on one side, there can be concern for growths or tumors that can be cancerous. But for this condition, the good news is they are not precancerous at all.
Okay, very good, thank you. And also, could you explain to us the relationship between asthma and nasal polyps, and will treating nasal polyps also help the asthma?
It's a great question. And that's why we're here together, because there's such a close relationship between the upper and lower airways that, as Dr. Laidlaw mentioned, that more than half, or even up to half of patients who have nasal polyps also have asthma. And it's really important to think about both conditions. They co-occur. And oftentimes when you treat the upper airway inflammation, you can also help with the lower airway inflammation. So working together as a multidisciplinary team is really critical, because oftentimes these are co-occurring and you need multiple types of doctors, not just one.
In fact, we often find that, if I'm the one mostly treating the asthma and Dr. Lee's the one mostly treating the polyps, when she takes them to sinus surgery and does a really thorough surgery and their polyps feel great and their sinuses are great, their asthma is magically much better after her surgeries as well. Even though her intention was to treat the polyps, there's some kind of connection with that inflammation. So often her doing her surgery actually makes my job easier, because the asthma, at least while the polyps are gone, is often easier to treat as well.
That's good to hear. Dr. Laidlaw, could you answer the question, do my allergies and or asthma make nasal polyps worse?
It's a complicated question, but it's a really good one. I'm going to sort of flip it around a little bit. So I will say that the nasal polyps can make your asthma worse. And we know this because many of our patients who have both will say, when my nose is bad, my asthma is bad. And if my nose is good, right after a good surgery with Dr. Lee, my asthma's better. So we know there's a connection there for sure. The opposite isn't always true. So we do have patients who can have an asthma attack or an asthma exacerbation and their polyps don't necessarily get worse. But if you look overall at patients who have polyps and no asthma, or polyps and asthma, often the patients who also have asthma tend to have worse polyps. So there is some kind of connection there. The allergies component is a little bit different. And here's where I don't think from the research side that truly allergies cause the polyps. But if you have allergy symptoms in your nose during certain seasons or exposures to dust or certain pets, and you also have polyps, almost by definition, anything that makes your regular nose allergies worse is going to make your polyps worse too, because the inflammation is going to get worse. So there are lots of times we need to carefully approach both the polyps and any environmental allergies that our patients have, and make sure we're considering them both to make sure that both things can get better.
Okay, thank you. And Dr. Lee, our last questions. Do I have to rinse and spray my nose forever? And can nasal polyps go away on their own?
Yeah, thanks, Jay. Forever is a long time, but it's so important to maintain the health of your airway by doing these irrigations and topical sprays. Unfortunately, polyps do not usually go away on their own. We can wish that, but unfortunately they don't. So it's so important that you see your doctors and have that team to help take care of you. And we are here for you to help you with that process every step of the way. There's a lot of decision making, a lot of symptoms that are unique to different patients, and differences in also what's important to, different people. So it's really important to do those maintenance. I call it the nasal wellness routine, but it is really important to maintain the health of your nose and sinuses by doing some of these treatments.
Well, Dr. Laidlaw, Dr. Lee, thank you both so much for going over the nasal polyps basics with us. We're excited for future parts of our series as well. And just for future reference, what will we go over next in the series? Well, future videos will cover the following subjects: medical options and treatments for nasal polyps, surgical options for removing nasal polyps, navigating nasal polyps and related chronic conditions, practical tips for managing nasal polyps, holistic health approaches, and other subjects as well. Again, thank you both for joining us. I'd like to take this opportunity as well to thank Sanofi and Regeneron for their support in our educational program. All the content for this discussion was developed independently by AAFA and the speakers. Thank you all for joining us, and we look forward to seeing you again. Keep an eye out for future videos in the series.